Welcome to Excite Medical's educational video about your spine and the DRX9000. Over the next 6 minutes, we will break down your vertebral column, bulging discs, herniated discs, degenerative disease, and the DRX9000 treatment. The spinal column or backbone is one of the most important parts of your body. It provides you the ability to stand upright, bend, and twist. "33 individual bones interlock with each other to form your spinal column. The vertebrae are numbered and divided into 4 main regions. C1 through C7 cervical vertebrae form your neck, supporting your head, allowing you to nod and shake your head at things you don't like. T1 through T12 are your thoracic vertebrae that are joined by ribs to form your rib cage. Lumbar vertebrae carry most of the weight of your upper body and provide a stable centre of gravity when you move. Your sacrum and coccyx make up the back wall of your pelvis. Intervertebral discs are located between each of the movable vertebrae. Discs consist of a rubber band-like outer ring with crisscrossing fibres called the annulus fibrosus that surrounds a jelly-like centre, the nucleus pulposus. Discs function like shock-absorbing springs. The annulus pulls the vertebral bodies together against the elastic resistance of the gelatinous-like nucleus. When you bend, the nucleus acts like a ball bearing, allowing the vertebral bodies to roll over the incompressible gel. Each disc works together with 2 facet joints forming a spinal motion segment. The biomechanical function of each pair of facet joints is to guide and limit the movement of the corresponding spinal motion segments. The surfaces of these joints are coated with cartilage that helps each joint move smoothly. Directly behind the discs, the rain-like vertebral bodies create a vertical tunnel called the spinal canal or neural canal. The spinal cord and nerves pass through the spinal canal, which protects them from injury. The spinal cord is the major column of nerve tissue that is connected to the brain and serves as an information superhighway between the brain and the body. The nerves in your spinal cord branch off to form pairs of nerve roots that travel through the small openings between each of your vertebrae, called vertebral foramens. This is the condition of a normal lumbar intervertebral disc. Degenerative disease is the loss of disc height that may impact adjacent nerve roots. When the jelly-like nucleus pushes against the annulus wall, it is called a bulging disc. When that gel-like core pushes out through a tear in the fibrous wall, it is referred to as a herniated disc. These conditions may impact the surrounding nerves, causing sharp, severe, and/or debilitating back pain. They may also cause neuropathy, sciatica, or other symptoms. The DRX is a highly effective, non-surgical and drug-free treatment for these conditions. The DRX9000 machine is the world's first disc therapy that is able to target a specific disc level, adjusts itself 13 times per second, and pulls utilizing a logarithmic curve. These 3 factors ensure that each patient experiences an ultra-smooth treatment that is delivered with consistent precision. Research and findings by medical doctors associated with prestigious medical institutions, such as the Mayo Clinic, Stanford, and Johns Hopkins, reveal that patients who qualified and underwent the DRX9000 treatment had an 88 to 90% success rate. During a comfortable 30-minute DRX treatment, The pressure inside the disc is dropped by more than 200 millimeters of mercury, creating a vacuum-like effect, bringing nutrients and fluids back into the disc. In the case of degenerative disc disease, nutrients and fluids are brought back into the disc, increasing the disc height. In cases of bulging discs, the incredible negative pressure created inside the disc by the DRX9000 brings the nucleus pulposus back to the center. Similarly, in cases of herniated discs, the jelly-like nucleus comes back to the center. As a result, it takes pressure off of the impacted nerve roots, relieving patients of their related symptoms. These results have been proven in pre- and post-MRI findings, amongst other peer-reviewed research. Thank you for taking the time and watching this informative video. If you'd like more information on the DRX9000 or to find a provider near you, visit DRX9000.com. You can also call or text +1 813 210 1000.